Emcyt is a medication that is used to treat certain types of prostate cancer. It works by breaking down into estrogens and a type of cancer drug in the body. This helps to interfere with prostate cancer and slow down or stop the growth of cancer cells. The daily dosage and the optimal timing for taking this medication should be determined by your doctor. When taking Emcyt, make sure to take it on an empty stomach, either an hour before or 2 hours after a meal, as directed by your doctor. It's usually taken 3 to 4 times a day. Remember to take it with a full glass of water unless your doctor tells you otherwise. It's important to take Emcyt regularly at the same times each day to get the most benefit from it. The dosage will depend on your medical condition, weight, and how you respond to the therapy. Take Emcyt 3 hours before or after taking any products containing magnesium, aluminum, or calcium, such as quinapril, didanosine, vitamins/minerals, and antacids. This ensures that the medication is fully absorbed. Do not increase your dose or take Emcyt more often than prescribed, as it won't improve your condition faster and may increase the risk of serious side effects. It's also important to note that since Emcyt can be absorbed through the skin and lungs, pregnant women or those who may become pregnant should avoid handling the medication or breathing in the dust from the capsules. Side effects of Emcyt may include nausea, vomiting, loss of appetite, flushing, dry skin, headache, leg cramps, decreased sexual interest/ability, and male breast tenderness/enlargement. If any of these effects last or get worse, tell your doctor or pharmacist promptly. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. This medication may raise your blood pressure. Check your blood pressure regularly and tell your doctor if the results are high. Tell your doctor right away if you have any serious side effects, including mental/mood changes, such as depression, swelling of hands/feet, worsening of seizures, increased thirst/urination, nausea/vomiting that doesn't stop, easy bruising/bleeding, stomach/abdominal pain, dark urine, yellowing eyes/skin. This medication may rarely cause serious problems such as heart attacks, stroke, and blood clots. Get medical help right away if you experience any of the following symptoms: chest/jaw/left arm pain, sudden severe headache, weakness on one side of the body, confusion, trouble speaking, sudden vision changes, such as double vision, loss of vision, pain/redness/swelling of legs, shortness of breath, coughing up blood, sudden dizziness/fainting. This medication can lower the body's ability to fight an infection. Tell your doctor promptly if you develop any signs of an infection such as sore throat that doesn't go away, fever, or chills. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Before taking Emcyt, it's important to communicate any allergies to your doctor or pharmacist. Additionally, it's crucial to discuss your medical history, including any history of blood clots, bone disease, high cholesterol or triglyceride levels, depression, diabetes, heart disease, high blood pressure, kidney disease, liver disease, seizures, stroke, or thyroid problems. It's also important to avoid smoking while taking Emcyt, as it can further increase the risk of certain health issues. If you are planning to have surgery or will be immobile for an extended period, notify your doctor as special precautions may be necessary to reduce the risk of blood clots. For those with diabetes, it's important to monitor blood sugar levels regularly while taking Emcyt. Additionally, individuals who are nearsighted or wear contact lenses should be aware of potential vision problems and should contact their eye doctor if any issues arise. Emcyt may also cause dark spots on the skin, so it's important to limit sun exposure, use sunscreen, and wear protective clothing when outdoors. This medication may also affect sperm production, so it's important to use reliable birth control while taking Emcyt. It's important to note that Emcyt is not typically used in women and is unlikely to be used during pregnancy or while breastfeeding. If you have any questions about this medication, it's important to consult your doctor. It's important to be aware of potential drug interactions when taking Emcyt. This medication may interact with other drugs such as aromatase inhibitors, corticosteroids, ospemifene, tamoxifen, troliendomycin, and medication for low thyroid. Additionally, certain drugs can affect the estrogen levels in your system, including azole antifungals, many antibiotics, aprepitant, bexarotene, bosentan, dapsone, certain HIV protease inhibitors, modafinil, rifamycins, ritonavir, many seizure medications, and St. John's wort. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. And always consult your doctor before starting, stopping, or changing the dosage of any medicines. If you suspect an overdose or serious symptoms such as passing out or trouble breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center for assistance. It is important not to share this medication with others. While taking Emcyt, it is important to have regular lab tests, such as blood pressure, liver function, and calcium levels. It is also important to keep all medical and lab appointments. Consult your doctor for more details. If you forget to take a dose of Emcyt, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. It's important to store Emcyt in the refrigerator, away from light and moisture. It's also essential to keep it out of the reach of children and pets. When you no longer need it or when it's expired, make sure to properly discard the product as instructed by your pharmacist or local waste disposal company. And remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.